Health insurance shouldn't be tied to employers. To view the full article, click the first link in the description below. The inequities of this arrangement were clear from the start. It excluded elderly and disabled Americans because they couldn't work, and low-wage workers and racial minorities, because they couldn't secure the kinds of jobs that offered health insurance. But employer-based insurance was popular. Employers had better bargaining power than individuals, and it was easier to have them handle the logistics, and elected officials faced little pressure to create a more robust alternative. In the decades that followed, even as officials fortified public schools, transit systems and utilities, they left health care to the private markets. Eventually, Medicare, Medicaid and the Affordable Care Act filled some of the gaps created by employer-based insurance, but no program ever filled all of them. By 1960, roughly two-thirds of all Americans were insured by their employers. By 1970, health insurance had become big business, and by the 1980s health care costs were soaring. Some of that increase can be attributed to advances in technology that made care more expensive. But a great deal of the spike resulted from what economists refer to as price insensitivity and what the rest of us might call obliviousness. If the insurer is paying, nobody looks at the bill, says Zach Cooper, a health economist at the Yale School of Medicine. So you can raise prices as much as you want, and you can create a much more luxurious system overall, to justify it. Unencumbered by the demands of a cost-conscious clientele, hospitals ramped up equipment purchases, expanded hospital wings and workforces, created specialty clinics and then increased their reimbursement rates to pay for it all. Rather than scrutinize those price hikes, which were passed from hospitals to insurers to customers, employers simply accepted them. And why wouldn't they? The more generous the insurance package and the nicer the hospitals and clinics, the bigger the tax break for the. To view the full article, click the first link in the description below.